Does your character know what to expect with a natural death? Is it painful? How long does it last? What are the signs death is getting close? Did you know that death rattle is not the person's last breath? Do you need a timeline for your story with real-life examples? I've got you covered. Learn about all of this and more on today's episode. Welcome to Writing Rule with Allie, the Fiction Writer's Weekly inspiration station for rule life and lifestyles from historical to post-apocalyptic, helping you bring your rule stories to life. I'm Allie. This is episode number 88, Writing a Natural Death, Part 1. Stick around to the end to find out all the ways things could possibly go wrong. A quick disclaimer. I am in no way, shape, form, or fashion a medical anything. This is not medical advice, death advice, or any kind of advice. This is solely for the purposes of fiction writing and nothing else. Welcome to the Halloween episode. As many of you know, the last few years, but especially the last few months, have been rough for our family with several deaths. I've been to more deathbeds than I wish, and thankfully they have all been of natural causes. That's to say, I have some experience with this, and I will be passing it along while it is still fresh in my memory. For any family or friends listening or watching, this is your cue that I might talk about my family. If that bothers you, you might want to skip this one. For anyone else, I will do my best not to cry. But no promises. And with that said, let's get into this. Now, this topic is impossible to talk about without talking about hospice and the wonderful caregivers that work for them. If you don't know, hospice is what a person who has a terminal illness and is not expected to live more than 6 months is placed on. This is a team of caregivers, doctors, nurses, therapists, chaplains, and we can't forget the call center people who hold everyone together in the same loop. A quick note, remember, all deaths will be a little different, and no two are the same. And I know the same is true for pregnancies, but trust me, they're not the same. Also, each person will think, feel, and react differently to each death, and each character will feel differently about two deaths, just as many characters will feel differently about the same death. An example is that when my mom died, all of my brothers were devastated and cried and wanted to talk at her memorial service. However, I was dealing with postpartum at the time, and I didn't cry, and nor did I want to talk. And yes, many of my family members, not my brothers, have not forgiven me for that. I'm not complaining, just explaining that death is complicated. So let's go over a few timelines. Up to a year before the death, a person is likely to start noticing unusual weight loss. And I don't mean they're working out or on a diet, but unintentional loss that has no real explanation. In fact, this is actually the time that is most likely that a person can find something that's wrong with them, such as cancer, and take action to keep from dying. That said, it's also the number one sign that people like to ignore until it's too late to receive treatment. Historically and after the apocalypse, it's unlikely there is a treatment for something such as cancer. Another thing in this time that people overlook until too late can include, but is not limited to, wounds that do not close or heal, difficulty breathing, shortness of breath, feeling pressure or upper abdominal pain, fainting, dizziness, unexpected weakness, headaches that don't go away, sudden loss of vision, or even blurry vision without an injury, confusions or changes in mental status, although this one's more likely to be noticed by a person other than the person that is dying. Persistent vomiting or diarrhea, coughing or vomiting blood, fevers that don't go away, and more. 1 to 3 months before a death, there are some new changes. The person can seem to withdraw from the world around them. In my father and my in-laws' cases, they didn't reach out as often, and they were not as chatty as normal. One was a very talkative person, and the other was a storyteller and loved to laugh. Both had a noticeable reduction in this. When they do talk, it's more common for them to want to talk about the past and reminisce about old times. There will be a reduced appetite or thirst. This can manifest in several ways. For my mother, she had nausea and vomiting. Keep in mind, she was on chemo, but it lasted longer than the normal chemo effects. My father couldn't eat as much. Either he was full or nauseous. My in-law just ate less often and smaller amounts when he did eat. I have known others that have only wanted sweets. One thing I have noticed is that several of them had taste changes, making food taste bland or unenjoyable. Many of these happened years or even decades before COVID was even a thing. Another is that weight loss is very common at this time too. partly from slowing down eating, but definitely more than you would expect from only slowing down with their food intake. And let me say, that arm wasting is very common at this time too. So common that I have rarely met a person that did not have this sign, and I grew up in nursing homes every day because both of my parents worked at them when I was young. There is an increased risk of infection at this time. In fact, it's so common that roughly 13 to 20% of natural deaths have an infection as a contributing factor. That is 1 or 2 out of every 10 deaths. However, globally there are estimates that is as high as 1 in 7 deaths. This will be more likely in historical or post-apocalyptic settings. Pain and nausea can increase during this time. Many times it's just uncomfortable feelings that over-the-counter medicine can take care of. Or, in history, a cup of willow bark tea. However, some diseases are much more painful and will require help to control the pain. Some of these can include colon or rectal cancer. The desire to sleep often starts to increase at this time. Sometimes it can look like taking naps, and others just fall asleep wherever they are. Going to bed earlier and getting up later are also common. If this is a child, they might want to be held to sleep or to snuggle with a parent. A mental thing that happens at this time is a sense of euphoria. I'm a Christian and believe there's a reason for that. Others believe that it's the body's natural chemistry changes that happen at this time. At the same time, others can feel a sense of dread. I repeat the same causes as the last one. However, the part that some people struggle most with is that dying people can feel both of these at the same time. This is weirdly common at this stage and frankly to be expected. That said, many feel different from what they expected as the time draws closer, and that can be distressing to them. In the weeks before death, 1 to 2 weeks, a person will be sleeping more. In fact, they're likely to be sleeping more than they're awake. This is very normal and not cause for alarm. In fact, in every case I have seen, it felt natural and seemed relaxing both to the person dying and their caregiver. Even so, some people can be saddened by this, as they will realize that it's likely they're getting closer to death. Other things that are common are an increased confusion. This is believed to be because the body is shutting down. Keep in mind, each person is different, and some people will be lucid, that means mentally present, the whole time. Suggestion is common at this time. Also, there will be a greater decrease in their food intake than even before. I have seen some with the appetite of a newborn about once a day. Whatever they want is perfectly fine, and food and drink should not be forced if they don't want it. This is also the time they might start to have problems swallowing. Food and drinks might have to be thickened so that they don't choke on them. I find that most people end up having a honey consistency, and that's normally the easiest for them to take at this time, but not everyone is the same. Some of the physical changes are lowering body temperature. While some people will have a fever, those who do not will have their temperatures go down, and their hands and feet will become cold to the touch. The person may or may not notice these changes. There can be skin color changes in the hands, feet, lips, nose, ears, toes, and well, pretty much anywhere that a person would worry about getting frostbite. The colors can look bluish, purplish, grayish, or they could just seem off. These can be all over the area or in blotches. Weakness and fatigue are common at this time, making these people fall risk also. Many people will be in bed, unable to get out. I have had one person who had this issue, but still managed to swing an IV pole at my head and climb out of bed over the bed railing while I was trying to call a nurse to help because they had ripped out their IVs. While most people will be in bed, there are some that can surprise you. Sudden leg and arm movements, or jerkiness, if you will, are common. They do not need a history of this. It could be twitches or larger movements, usually looking like they are restless and trying to get comfortable. If they don't show any signs of discomfort, then it's unlikely that this is caused by a discomfort. And talking less is common. Some people don't talk more than a few words during this time. My father was one of those people, but he still loved to hear you talk. Side note, it's believed that hearing is the last thing to stop when people die. That means it's likely that they can hear you long after they are no longer able to reply. And is the reason talking to people can help ease their signs of discomfort, as most people don't want to be alone. Other things that happen in this time is lowered blood pressure, incontinence, or the lack of bladder control. Constipation or nausea. Irregular breathing that can be faster or slower or even speed up and then slow down are also common. Increased sweating can start during this time and is more common the closer they get to death. Pain can become an issue. Now, let me be clear here. Death, at least natural death, is not painful. Our bodies are naturally designed to die just as they are to be born. What can be painful are certain diseases. Some of these include ALS, Parkinson's, or any kind of disease that obstructs the bowels. My mother fell into this category as she died of colon cancer. In my mother's case, as with most cases, hospice workers were able to keep the pain under control. She, as some other people, was worried about becoming addicted to pain medicine, since morphine is a common drug of choice. There is no need to worry about this, as first, it isn't long-term because, well, they're dying, and second, it helps control the pain. No one wants to die in pain. Historically, some people just died in pain, and others chose to end things themselves or their family members did. I'm not saying this is right or wrong, I'm just stating that it happened. Common question asked by caregivers of nonverbal or unconscious people, because some diseases like Alzheimer's leave people like this, is how do you tell if they're in pain? Well, there are signs. Things such as restlessness or agitation can be a sign. Groaning a lot, flinching, or guarding when touched are other signs. At this time, terminal secretions start to happen. This is what's called the death rattle. Yes, I was shocked to learn this, as I thought it was the last breath, but it was not. In fact, it starts about 2 weeks before the death. Not to get technical, the body will still be making saliva, but the brain will not be triggered to swallow it as it would have been before. This leaves the person having to breathe over or around the small amount of saliva that they would have swallowed. This makes a gurgling, rattly sound that it got its name from. In modern times, there are medicines to help with this. It's something that we have chosen for our loved ones as they were distressed because they felt like they needed to spit something out and they couldn't. The terminal secretions medicine helped and they were able to relax better. Other non-medicine ways to help with this is to place them with a bit of elevation in a bed that moves or with pillows to prop them up. Another way is to roll them on their side and just let them drool it out of the side of their mouth. In the days before death, there are a few common things. First, that we will cover, is visioning. This is when a person is lucid. That means that they are completely of sound mind and they see and often hold conversations with their dead loved ones. Many times they say that they're told their family misses them and that the family member will be back to get them for a trip. This normally brings them peace and they're happy about it. In fact, this happened to all but 2 of the deaths that I have been to. This is not considered a hallucination. That is a distinction that is very important to know. If you enjoyed this podcast and you're listening on YouTube, subscribe and hit the like button. Drop me a comment. I love to hear from you and answer questions. Don't forget to share with a friend. This episode has grown much longer than I expected, and since I have much more to say, I will finish this episode next week. Thanks for listening. Until next time, happy wordsmithing.